Hello everyone. Hello everyone. Happy Independence Day to all of you, and I welcome you all to the special marathon session. The session to boost your confidence, the session to motivate you, the session to boost your preparation, and the session which takes you one step, two step, and the three step, and two closer to your selection. And from my side, I hope video, audio, everything is coming very clearly. And I hope every one of you are ready for this beautiful session. Okay, so who all are live to the session, please do fatafat hit the like button and do share the class with your friends so that they can also can join to this wonderful session to learn and to achieve. Right? So let me share the class in your WhatsApp groups and all so that all your friends, everyone can join. And who all are still not a part of our WhatsApp group, you can join to the WhatsApp groups and channel, so that will be completely free of cost to all of you. For continuous and most authentic updates, do join the master nursing classes. Good evening, very good evening to all of you. Yes, can anyone please do confirm whether audio, video, everything is clear from my side? For sure, beta. So you take the selection, I will come to meet you. Okay, you don't come to meet me, I will definitely come to meet you. You take the selection. Okay. Don't fear, guys. Your master is here, and I will do my best to support you all to push in the selection list. Okay. Right. So every one of you, for to hit the like button and share the class also. We will start it. Okay. Right. So the today's session, I am starting with a very important motivational line, which you can see on the screen. And legendary all-rounder cricketer of the India, Hardik Pandya. You know, in the year of 2024, what happening? Very bad time, very bad time. Even Indian own people was trolling him. And this man, who whenever he will go into the field to play, entire stadium is telling chapri, chapri, chapri. And entire stadium is making him and troll and demotivating him. But he have not came in front of any media. He have not told anything, any bad comment about the Indian peoples, and especially uh, about the his haters also. He have not told anything. But one thing he have done is he was waiting for the opportunity. Okay, he was waiting for the opportunity, and when the opportunity came in the year of 2024, he have done his best work. And this person, where entire India told, yes, an entire India told he is unable to make, but he made the bounce back. And here you can see the man with the victory, the man with the happiness, the man with the success. Are you able to see who is he? The same person where the entire Indian people was trolling him. The same person who hold the 20th over ball in the hand and who delivered the ball in the 2024 World Cup, and the same person who delivered the last over and brought the victory to the India. And on that day, he told only one thing: I was broken inside, but I was focused. And I was waiting for my chance and I was waiting for my opportunity. So, the moral of this story is, when your bad time will come, don't respond anything to anyone. Be silent, be cool, be calm, be relaxed. And you say to yourself, when my time will come, only my success will tell everything to you. This is the only word you have to tell to your haters. And those people who told it is not possible from us. So I used to tell one word repeatedly, that for those people, one kg of the extra sweet will go with the 1 kg of extra sugar inside of that one. Right? Right? So be relaxed, be cool, be calm, and your opportunity is waiting for you. Within a 1 month, you have your opportunity in hand. Keep your action in the peak and keep your all the efforts, motivation, everything in the peak, especially discipline also you keep in the peak. Definitely your day will come where we will celebrate your success together. Okay? Chalo. So fasten your seat belt. Now I am going to take you to a beautiful ride on the very important questions. First, we will discuss and 10 to 15 golden points on the non-nursing portion. After that, we will come to the nursing portion and we will do very best in the nursing portion also. Right? Every one of you ready? Fadafat do thumbs up in the comment box so that I can proceed with the class. Right? Chalo. The class is going to start now, and here it comes to the and first question. Yes, here it comes to the and very important first question, which is waiting for our brilliant answer. Yes. Which team won the Indian Premier League 2026? Same answer. If the 2025 also, the same team won. Again, the in the 2026 also, same team won the Indian Premier League, IPL. Okay, so which team is that one? Option A, Chennai Super Kings, CSK. Option B is the Mumbai Indians. Option C is the Kolkata Knight Riders. And option D is the Royal Challengers Bangalore. D. Every one of you agree with the option D? Right? Yes. Chalo. Very good answer. The answer D is the correct. So Royal Challengers Bangalore is the team which won the Indian Premier League 2026, and in the year of the 2025 also they are the champions. Okay, in the year of 2025, 2026, two times continuously they are the champions, and in the 2027 also they may also become champion because their team is very strong. Okay, chalo. And here it comes to the next question. Which monument is featured on the back side of the current 50 rupees Indian currency note? Current 50 rupees Indian currency note, what we have on its back side, which monument is featured? Option A, we have the red pot. Option B is the Humpy with chariot, and option C is the Supta, and option D is the Rani Ki Vav. What is your answer? At the back side of the 50 rupees current Indian currency note, so what we have? Option B. Can I lock option B? Humpy with chariot. Can I lock it? Guys, every one of you fatafa do like to the session now. These many people are live in the session, more than 250, and very few like I am able to see here. Fatafa do hit the like button. Okay, yes. So the Humpy with chariot is the correct answer. This is the 100% is correct answer. Yes, locked. So you can see this is the one time asked question in the previous year in the Norcet. So there may be a chance to repeat. We will discuss all the very important points here. You can see the 50 rupees notes, current Indian 50 rupees notes. On the 50 rupees notes, this monument what we have, this is the Humpy with chariot. Humpy with chariot. Sir, on the 500 rupees notes, what we have, sir? On the 500 rupees notes, we have the red pot. Okay, red pot is present on the 500 rupees notes. Okay, sir, on the 200 rupees notes, sir, on the 200 rupees notes, this monument, the monument which is present on the 200 rupees notes, that is the Sanchi Stupa. Okay, Sanchi Stupa. So this is the very important, right? So on the 50, Humpy with chariot, on the 500, red pot, and on the 200, Sanchi Stupa. And we have the 100 rupees notes. On the 100 rupees notes, we have the Rani Ki Vav. On the 100 rupees notes, we have the an monument. So that is called as the Rani Ki Vav, right? And we have the 2000 rupees notes. On the 2000 rupees notes, we have the Mangalyana. Okay, Mangalyana's symbol we have on the 2000 rupees notes, right? Yes, sir. Next we have is an 20 rupees notes. On the 20 rupees notes, we have the Ellora Caves. The monument which is present on the 20 rupees notes, we have the Ellora Caves. Don't worry, uh, this particular notes I will upload in the app. So after the class, you can get the notes. Okay, don't worry. Just focus on the class now. Right? Yes. Yes. So this was the PYQ one time asked. So there may be a chance to again ask in the exam as well. Okay. So on the 20 rupees notes, we have the Ellora Caves. Right? Yes, sir. And here it comes to the 10 rupees notes. On the 10 rupees notes, we have the Sun Temple, Konark. So this is on the 10 rupees notes. These are the very important MCQs where you can get in your exam. Please do keep in your mind. Okay. So here it comes to the next question. And on the revolutions, so in the last Norcet 10 also one question was there. Okay. Right. So tell me your answer, every one of you. Who all are live in the session, please completely do involve with your complete mind in the session so that whatever the points we are discussing, whatever the a question we are discussing, if you are involving it your complete mind, you will better learn and you will better understand. Don't silently sit and watch to the session. Be completely near to the screen and watch the comments and watch the answers, and you also give the answer. You don't think whether the right, wrong, nothing. Okay, nothing is right, nothing is wrong. Only the thing is learning and being perfect. That's it. Okay, yes. Very good, every one of you. The answer for this question will be the MS Swaminathan is the father of the Green Revolution. Okay, father of the Green Revolution we have the MS Swaminathan. Okay, chalo. Note can't accessible in laptop. Okay, we will give the access today to the laptop also. Don't worry. Okay, chalo. So here it comes to the and quick revision points. Guys, this green revolution is related to the which field or which sector? This is related to the agriculture. Okay, so this is related to the agriculture. The question may comes in your exam. Sir, what about white revolution, sir? White revolution is related to the milk and the dairy product. So this is also may your expected question. The white revolution is related to the milk and dairy product. In your Narset 10 only, in the last Narset only the question was there. Okay, in the last Narset only the question was there. Right? Next we have the blue revolution. The fish and aquaculture. Blue revolution is related to the fish and aquaculture. And we have, sir, this yellow revolution. Yellow revolution is related to the oil seed production, and the blue revolution is related to the fish and aquaculture. Yellow is related to the oil seeds production. Okay, and we have the golden revolution. This is related to the horticulture. This is related to the horticulture. Sir, we have the pink revolution. Pink revolution, sir. Meat and onion production. Important. Very important. This pink revolution is related to the meat and onion production. Yes, sir. Next we have, sir, silver revolution. Silver revolution is related to the egg and the poultry production. Egg and poultry production, we have the silver revolution. And sir, red revolution, this is related to the again and meat and tomato production both. Right? Yes, sir. Next we have, sir, brown revolution. Brown is related to the and leather, coke, and the non-conventional energy. So brown revolution we have. Sir, black revolution. This is related to petroleum products or the crude oil products. So from this one only, you may get the question in your upcoming Narset 11 exam. Okay, so this is because trending thing which is happening in the India. So please do remember about this one. Black revolution is related to the and petroleum products and crude oil problem. Okay, next, sir, we have the gray revolution regarding fertilizer and the round revolutions regarding the potato production. Sir, can we need to remember all the things, sir? Can we need to bring all the things? Can we need to remember, sir? No. So I will highlight the 5 things. You do remember the 5 things only. The first one will be the black revolution. So I will give the point number 1 to the black revolution only. This one you have to must and should remember. That is related to petroleum products. That is related to crude oil. And after that, you remember related to the silver revolution. That is the egg and poultry production. Egg and poultry production, silver revolution. Sir, after that, you do remember the meat and onion. That is the pink revolution. After that, sir, green revolution, you do remember agriculture. And sir, you do remember about these 3. Because these 3 are very frequently asked question. All together, you remember these 3. Okay. Important. Please do remember this. Okay, remaining, if you want to skip, you can skip, but whatever I highlighted, that one you have to must and should remember. Okay, here it comes to the next question. Fatafat. Do read the question carefully, completely, properly, perfectly, and give your best answer. Yes, beta. Varghese Kurian is for the White Revolution. Very good. Tamil Nadu. Bharatanatyam is the classical dance from the which Indian state is the question, which is there in front of you all. B option. Yes. Very good. So answer for this question will be the option B only. Okay. Tamil Nadu. Tamil Nadu is the state which is classically associated with the Bharatanatyam classical dance. So please do remember this one. From here, you can expect one question. So that is from the and state and the its associated dance. Okay, sir. Can we need to remember all these things, sir? No. Wherever I have made the stars, you mustn't remember this. So remaining, if you are unable to remember, also not a problem. But wherever the star are made, that one is must for the exam. Please do remember these things. Okay. So let me check first one. The Andhra Pradesh one. Here we have the Kuchipudi. Most frequently asked question. So the classical folk or the classical folk dance which is associated with the Andhra Pradesh is the Kuchipudi. Okay. And Assam, that is the Bihu. Gujarat, that is the Garba or the Dhandiya. Okay, Garba and Dhandiya is of the Gujarat. And Haryana state, Pag. Karnataka state, Yakshagana. Kerala, Kathakali. And Mohiniyattam. So this is also I'm making the star. Okay. Yes, sir. Madhya Pradesh, Matki are the Gauru Maria. Maharashtra, Lavani we have and Tamasha we have. And the Odisha, Odissi, that is the classical, and the folk will be the Chahu we have. And the Punjab, Bhangra, and the Rajasthan, Humor, Tamil Nadu, Bharatanatyam, Uttar Pradesh, Kathak. Sir, in this one, which all are important, sir? In this one, Tamil Nadu, Bharatanatyam is very important. Okay. Sir, Punjab, Bhangra is very important. And sir, Kerala, Mohiniyattam is very important. Or the Kathakali, both will be associated with Kerala. So these are very important. And sir, Karnataka Yakshagana is very important. Gujarat, Garba and Dhandiya is very important. Andhra Pradesh, Kuchipudi is very important. Okay. These are the points which you have to keep in our mind. Okay. Clear to all of you? Right. So these are the double star made points is must to remember. Remaining, if you are forgetting, also not a problem, because from here most frequently questions are asked. Right. Chalo. So next we are going for the this one. I don't want any wrong answer from any one of you. So, but every one of you put your correct answer in the comment box. And who all are still not liked to the session, fatafa do like to the session. Almost 350 people are live, and only 200 means only near 200 likes we have. Okay, hit it out. Fatafa, every one of you hit the like button also. Yes. What is the national song of India? Good evening, very good evening. And mixed answers are coming. Some of you are going with a Janagana Mana, and some of you are going with a Vande Matram. Yes. Very good, Ganga. So Ganga is telling, sir, option A, Janagana Mana is the national anthem, sir. It is not a national song. Vande Mataram is the national song, sir. Yes, your answer is very much correct. So here the question is not asking about the national anthem. The question is asking about the national song. So your answer should go here as the Vande Mataram. Vande Mataram is our national song, and Janagana Mana is our national anthem. Okay, so the list which I am showing you now, that is the very important list which we have studied in our first standard, second standard of the school only. Okay, that one also is asking in the Norcet exam. I think in the Norcet 8 or 7, the question asked, what is the and national aquatic animal? What is the national tree? Like this. The question have been came in the non-nursing portion. Guys, non-nursing portion will come such a easy, very easy it will come. Okay, so that one we will study now here. Okay, let's go to their school. What is the national animal? Fatafat, every one of you comment what is the national animal. National animal we have is the tiger. Okay, like you all, right? Yes, sir. So national aquatic animal we have is the river dolphin. Don't get confused. National animal is the tiger. Sir, national aquatic animal is the river dolphin. River dolphin, right? Yes. Sir, we have the national bird. National bird, that is the Indian peacock. Indian peacock is the national bird. And sir, next we have, sir, national fruit is the mango. Mango is the national fruit. Okay, that is my favorite fruit. National flower we have lotus. Okay, national flower we have, that is the lotus, right? Don't say national flower is the pushpa. Pushpa is the international flower, not a national. Okay. Chalo. So national flower we have is the lotus, and we have the national tree, banyan tree. National tree is the banyan tree, and sir we have the national emblem. National emblem we have, so that is the state emblem of India, right? Yes, sir. Next, national flag, sir. We have the Tiranga is the national flag. Sir, national river, sir. Ganga is the national river. Sir, national anthem we have, sir. National anthem is the Jana Gana Mana and national song is the Vande Mataram. These are the points which you have to keep in our mind. Chalo. Let me take you to the quick revision. Tell me the first answer. What is the national animal of the India? Padafat. National animal of the India. I don't want any wrong answer from any one of you. Very good. So national animal of the India is the tiger. Very good. Next, national aquatic animal of the India. National aquatic animal. Very good. So that is the river dolphin. River dolphin is the and national aquatic animal. Sir, what is the national bird, sir? National bird. Which one is the called? Which one is called as the national bird? You see in the comment box, dolphins also coming. Tiger also coming in the comment box. Okay. Peacock. Okay, peacock. Very good. So we have the national fruit, sir. What is the national fruit? Apple or mango? What is the national fruit? Very good. Very good. National fruit is the mango. Mango is the national fruit. Very perfect. Chalo. We have the national flower, the pushpa. Don't consider pushpa as the national flower now. So pushpa means not a flower. Pushpa means fire. Right? Yes. So lotus. Very good. National flower we have is the lotus. And the national tree, sir. National tree. Which one is the national tree, sir? Banyan tree. See someone writing mango tree, guys. Mango is the national fruit, and the national tree is the banyan tree. Okay, not mango tree. Right? Chalo, very good. So, national emblem. What is the national emblem? National emblem, every one of you know, that is the state emblem. State emblem of the India is the national emblem. So, next is national flag. We have the Tiranga. And tell me the national river. Now, directly tell me the national river. National river. National river. Ganga. Okay, Ganga is the national river. Chalo, national anthem, sir. National anthem. Anthem. Yes, Jana Gana Mana is the national anthem. Okay, very good. So, national song, sir. National song. National song, sir. Very good. So, national song is the Vande Mataram. Vande Mataram is the national song. Okay, don't get confused. Very simple question. It is going to give the 1 marks. You know the matter of the 1 marks. 1 marks matter last. Okay, it is going to matter a lot. You ask to those person who is repeatedly giving the Norcet and just remaining with the 1 marks. So he will explain you the importance of 1 marks, right? So don't neglect. Okay, so because every single and even a point 0.5 mark means 0.5 marks is going to take your rank very high and very low. Okay, so these are very simple and easy to take a marks. Okay, don't get and don't do any neglect in the this portion. Okay, chalo. So do focus and do it, make it correct. That's it. Chalo. Next question is here. 1 marks matter is lot. Okay, and not studying and not selecting means that is not going to hurt. Even after studying, just we are remaining with 1 marks, so that is going to hurt very lots. So do focus, be confident, so that 1 marks you can add on easily, right? So the next question is, who is the author of the autobiography of the Wings of Fire? Wings of Fire. Very good. So everybody's answer very correct. So Abdul Kalam is the an author of the autobiography Wings of Fire. Autobiography Wings of Fire is the autobiography of the Dr. APJ Abdul Kalam. Okay, the proud Muslim of the India, right? Yes, and he is my guru, and he is my personal motivation, because he started the journey with a cycle and he went up to missile, the missile man of India, right? So we have the lots of the living examples, so that we can take directly in our mind, in our heart, and work towards our dream. Everything is possible. Started the journey with a cycle and went till the missile, and the missile man of the India. So that is our Dr. Respected APJ Abdul Kalam sir. Okay, yes. Chalo. So next question we have is, and the quick revision points we have is here. Dr. APJ Abdul Kalam sir, his famous book or the autobiography is The Wings of Fire. And Mahatma Gandhi, his autobiography is the My Experience with the Truth. And Sachin Tendulkar's autobiography is Playing It in My Way. Playing It in My Way. Yes? Yes. So next we have is the, and very important, Yuvraj Singh. Yuvraj Singh. The Test of My Life is the autobiography of the Yuvraj Singh. Answer for Kapil Dev. Do remember the Kapil Dev's autobiography, that is straight from the heart. Okay, so that is straight from the heart is the autobiography of the Kapil Dev. Do remember this name, it is important for your exam. And also remember the Sachin Tendulkar, Playing It in My Way. Okay, and the Mahatma Gandhi's is My Experience with the Truth. And next one we have is the Pandit Ravi Shankar, Raga Mela. Okay, Pandit Ravi Shankar's Raga Mela. And next we have is the PT Usha's, that is an Golden Girl, the Golden Girl. And the Usain Bolt's Faster Than the Lightning, Faster Than the Lightning. So these are the and achievers and the actual achievers, not only for the personal gain, and they contributed for the country, and now they are the, and many people they are the god, and many people they are the inspiration, and many people they are the energy. So name is enough to boost ourselves, and these are the names you have to remember for your exams. Okay, yes, yes. So the very important quick revision, fatafat, tell me, the Wings of Fire is the autobiography of the which person? Fatafat, put it your answer now. Here only revision, here only everything. Yes, very good. So that is APJ Abdul Kalam sir. Right. The next is My Experience with the Truth. What? Don't reduce your energy. Energy should be very high in the comment box. If you are reducing your energy, my energy also will going to down. Right? Very good. So the My Experience with the Truth is Mahatma Gandhi. Playing It in My Way. Playing It in My Way is the, yes, whose autography is this one? Playing It in My Way. Very good. Very good. Sachin Tendulkar's. Okay, Sachin Tendulkar's is the Playing It in My Way. And the Straight from the Heart. Straight from the Heart. Yes, Straight from the Heart. Very good. Very good, beta. Straight from the Heart is an autobiography of the Kapil Dev. Kapil Dev. Okay, very good. Next we have the Raga Mela. Yes. Next one, Raga Mela. Yes, very good, very good. The Pandit Ravi Shankar. Okay, Pandit Ravi Shankar's. And Golden Girl of the era. Yes, Golden Girl. Very nice. So the Golden Girl is of the PT Usha. PT Usha. Right. The next is Faster Than the Lightning is the Usain Bolt. Okay. Yes. So next is, and very important, please to keep in your mind. From here you can expect the question in the exam. Okay. Here it comes to the next question. Which initiative has launched by the National Highway Authority of India for the education of toll plaza employees children. So the people who is working in the toll plaza, for their employees, means those employees education purpose, National Highway Authority of India have launched one very important initiative. What is the name of that initiative? Option A is a project Arohana. Option B is the project Udhan. Option C is the project Yuva. And option D is the project Shiksha. Which one? Yes, very good. So answer for the question goes to the option A. So that is the project Arohana is for initiated for the and education of the toll plaza employees. This is initiated by the National Highway Authority of the India. Okay. Yes. Option A goes to the correct answer, not a shiksha. Okay. This is just for your distracting your mind. Right? Chalo. So next we have is this question. Hawa Mahal is located in which city? Important Mahals, important tourist place, and their city will be the a favorite question which may repeatedly strike in the exam. Hawa Mahal is located in which city is the question. Option A we have is the Udaipur, B we have is the Jodhpur, C is the Jaipur, D is the Bikaner. Where we have the Hawa Mahal? Jaipur. Yes, can I lock the option C? Can I lock it? Yes. In the pink city, Jaipur, we have the Hawa Mahal. Okay, so please do remember. Right? So this is the Hawa Mahal. See how beautiful is this one. Okay. So nowadays engineers will not make this beautiful structure. So this was made by an Indian engineers many year ago. Okay. So we are having the talent, but we are not having the motivation and discipline. That's it. If we are coming, our talent will come with the motivation and discipline, so no one can stop any Indian to make any changes in the world. Okay, yes, very good beta. So it is having the 953 plus windows, right? Yes. So this is present in the, this Hawa Mahal is present in the, and very important, Jaipur. It is also called as the Palace of the Winds. And here we have the 953 small windows. Okay, after selection, if you have the time, please do visit the Hawa Mahal, and built in the year of 1799, that is by the Maharaja Swasi Pratap Singh. Okay, so these are the very important golden points to be keep in our mind, right? Yes, sir. So the next is last year you visited, very good. So some important monuments and their cities in India. So where the examiner can ask the question, you can see the Taj Mahal. Are you able to see the Taj Mahal here? So where the Taj Mahal is located? Yes, you are living in the Jaipur. So when your friends come, will come from the and different city from the Karnataka, Kerala, Tamil Nadu, Andhra Pradesh, Telangana, you do help them to watch all the important tourist place in your city. Okay, so I will also come to your city for one day, definitely. Chalo. So Taj Mahal is in the Agra. Yes, so that is in the Agra, which is in the Uttar Pradesh state. Okay, Agra in the Uttar Pradesh state. Next we have is the Red Fort. Red Fort. Where we have the Red Fort? Red Fort is located where? Red Fort, Delhi. Yes, very good. Delhi it is located. Chalo, Qutub Minar. Qutub Minar. Norcet PYQ. PYQ. Qutub Minar. Where the Qutub Minar is located? Yes. Again Delhi. Chalo, very good. So Qutub Minar is located in the Delhi. Very good. So next is Indian Gate or the Gate of India. Yes. India Gate. Very good. Again in the Delhi. Next we have the sir Hawa Mahal. Just we discussed Hawa Mahal. Fatafat. Hawa Mahal. The state of Rajasthan. That is in Jaipur. Yes, very good. That is in Jaipur. Okay, in the state of Rajasthan. Okay, chalo. Please do remember it is important for the exam. Next we have is the Amar Port. Where we have the Amar Port. Amar Port. Very good. Again in the Jaipur, so that is in the Rajasthan. Please do remember. Okay, next, Gateway of India. Don't get confused. Gate of India, sorry, India Gate is different and Gateway of the India is different. Gateway of the India. Yes, Gateway of the India. Where it is located? Gateway of the India. Yes, it is in Amchi, Mumbai. Chalo. Mumbai in the Maharashtra. Right? Mumbai in the state of Maharashtra. The next is Charminar. Where the Charminar is located? Which is made by the Nizam. What is the kingdom of Nizams? चलो काय रे मिया नहीं दिखते क्या तुम्हें चार मीनार that is it is in our Hyderabad. Okay, so that is in the Telangana state. So Hyderabad we have the Charminar, very important. Okay, so next we have is the Sanchi Stupa. Where is the Sanchi Stupa located? Sanchi Stupa is located where? Very good, beta. Very good. So it is located in the Sanchi, that is in the Madhya Pradesh state. Okay, in Sanchi in the Madhya Pradesh state. Okay, chalo. Where we next we have the Sun Temple. Fatafat Sun Temple. I told the answer of the Sun Temple already while discussing the monuments on the Indian rupees. Very good. Very good. The Sun Temple is located in the Konark. Konark. Yes, in the state of the Odisha, in a Konark, we have the Sun Temple. Very important. Please do remember from here we can get the question in the exam. Next, we have the and Khajirao Temple. Khajirao temples. Where is the Khajirao temple is there? Yes, so that is also in a very important Madhya Pradesh. So that is in the Khajirao. Okay, so in the Khajirao in the Madhya Pradesh, we have the Khajirao temple. Next, sir, Golconda part. Where we have the Golconda part? Golconda part. Where we have the Golconda part? Who all are still not liked to the sessions, guys, fatafat hit the like button. See, more than 350 plus people are live to the session and very few likes I am getting. Who all are already liked, ignore. Okay, who all are still not liked, fatafat do like to the session, guys. Fatafat do like to the session. Your every like, your every motivation will help us to teach in a very high standard. Very good, beta. So Golconda part in Hyderabad, again in the Telangana. Chalo, Meenakshi Amma temple. Meenakshi Amma temple. Where is the Meenakshi Amma temple is located? Yes, Tamil Nadu in a Madurai. Very important. Chalo, the Madurai aspirants, AIMS Madurai aspirants, take a blessings from the Meenakshi Amma. This time definitely. Next time, not this time, because this time post is not there. Okay, so Meenakshi Amma will bless you to join the Madurai for definitely for sure. Okay, chalo. So next is Victoria Memorial. Where is the Victoria Memorial we have? Where we have the Victoria Memorial? Yes. This time no post, but next time you can expect 100 plus post at a time. Okay. Chalo. Very good. So we have the Victoria Memorial in the Kolkata, West Bengal. Okay, in the Kolkata, West Bengal, we have the Victoria Memorial. So these are the very important monuments which are important for your exam. And this is an simple information to all of you. So who all are preparing for Norcet 12, and if any one of your juniors and someone is preparing for the Norcet 12, we have the plan A1 from the basic to advanced. You can recommend this plan, the plan which is given the many results in the CRE senior nursing officer exam and the Norcet exam and the RRB exam. So this plan is definitely helpful the beginner who want to begin from very basic to very advanced, where you will get the 750 plus very basic to advanced lectures in a very simple English language. So you can recommend this plan to your juniors and your classmates and who want to prepare from very basic to advanced. Okay, chalo. So next we have is the this very important question which is there in front of you all. Do read the question and give your best possible answer. Why this time less post? So this time is very less post because many aims second phase of the recruitment is going to close. So they want to close the second phase of the recruitment, and in the next many aims the new means third phase of the recruitment will start. So you can again experience the burst of the recruitment. Okay, so don't think less number of the post. How many number of the post you want? You want only one post, right? You work for that, you strike for that. Definitely, that is going to, you will get it for the sure. Okay, so you work for that. Okay, chalo. The question is very simple. What is the mid upper arm circumference cutoff for the diagnosis of the SAM? Sir, what is the SAM? SAM is the severe acute malnutrition. Okay, sir, what is the SAM? SAM is the severe acute malnutrition is the sham. Okay, so please do remember this one. What is the cutoff? Everybody's answer is going to the option C. Yes. So from the severe acute malnutrition, for sure, one question you will get in the exam. That may be and from the management of the SAM. In the last Norcet 10, the question was there on the management of the severe acute malnutrition. That is especially related to the administration of the iron. Where I have before the exam, I have told you people like we should not give the iron in the and acute phase and in the stabilization phase we have to give the iron in the recovery phase. Okay, so everything we have discussed and many people done mistake again. So again this time also you will get the question on the severe acute malnutrition management and the diagnostic criteria. Don't make any mistake this time. Okay, yes, your Karnataka friend suggested the master nursing classes and the test series. Okay. Yes. So you can suggest to your all state friends so that it is the one of the highest quality and highest standard questions and the classes, everything which in a very affordable price which we are providing in the India. Okay. Yes. Chalo. So the cutoff of the severe acute malnutrition which will be there here, you can see the severe acute malnutrition cutoff. The weight for height as per the Z score is the less than -3 standard deviation, which means severely wasted child. Severely wasted child where the weight as compared to his height is less. Sir, how much less, sir? That is less than -3 standard deviation. So less than -3 standard deviation means can we say the severely wasted? Yes, sir. Severely wasting definition is the and less than -3 standard deviation weight for the height will be there. So point to be keep in our mind. Okay, chalo. Next we will be having is the and mid upper arm circumference MUAC. So that is less than 11 centimeter. Sorry, less than 11.5 centimeter. So this is one of very important question which you can get in your exam. Okay, next is bilateral pitting edema. Bilateral pitting edema, or also we call it the nutritional edema. This is present in both the feet or both the legs. So this is the and classical severe acute malnutrition's diagnostic criteria which may directly strikes in the exam. The question may comes from here. Please do remember. Yes, weight for height is less than -3 standard deviation and mid upper arm circumference is less than 11.5 centimeter and the bilaterally pitting edema is present especially in the foot or in the both the legs of the child. Okay, so these are the points which you have to keep in your mind. Okay, yes. For KA, already KA special batch is going on. For KA and RRB, you can join for the mission KA batch. Okay, for that you can contact the helpline number which is coming on the screen. Okay, chalo. So next you can you have to identify these two images. What you will think by looking at this particular image number A? What you will think? Whether this is in the kwashiorkor or the marasmus? What you will think? You look at the image number A and comment your answer. Yes, this is the kwashiorkor or marasmus? Kwashiorkor? Yes, very good. This is the kwashiorkor. Sir, what is the deficiency in the kwashiorkor, sir? Kwashiorkor, what is the deficiency? Yes, sir. Mainly we are getting the deficiency of the protein. So here we will be having the protein deficiency. Protein deficiency. Sir, protein deficiency, which means can I say albumin deficiency? Can I say albumin deficiency? Yes. Can I say? Yes, sir. Albumin is decreased, which means can I say, sir, plasma oncotic pressure is less? Plasma oncotic pressure is less? Yes, sir. We can say the decreased plasma oncotic pressure. Sir, plasma oncotic pressure is less means can I say patient is going to get the edema? Yes, can I say patient is going to get the edema? Yes, sir. Patient is going to get the edema and the face of the patient is edematous can I say the child is going to get the moon shaped face? Moon shaped face, moon shaped face. Yes, can I say? Yes, yes, sir. And sir, albumin is deficient, sir, which means liver will start to compensate and liver will try to produce the more albumin, sir. Hepatomegaly is going to happen. Can I say hepatomegaly? Hepatomegaly, can I say? Yes or no? Yes, sir. So you can see because of the edema, the abdomen is distended because in the abdominal area fluid is accumulated and the edematous face is there, the moon shaped face we will be getting. Okay. And sir, albumin is deficient, which means the liver have been started to compensate. Liver is working more. The size of the liver is increased. The hepatomegaly. Yes, sir. Okay, sir. Protein deficiency is there, sir. The protein deficiency is there, which means the health of the hair. How will be the health of the hair? Bad health will be there, right? So bad health will be there means we will be getting like this. Here, so you can see, are you able to see this image clearly? The base of the hair is one color and again black, again white, again black. So the different color of the hairs we are getting in a one hair. Okay, so this is black, white, black, like it is coming like this. Okay, can what we can say call to this one? Very good, better. So we can call to this one as the flag sign. So what we can call to this? We can call to this one as the flag sign. Sir, flag sign is seen in the kwashiorkor or marasmus. Where we will see the flag sign? In a kwashiorkor or the marasmus? Where we will see, sir? Fatafat. Do comment your answer. Yes. Kwashiorkor we will see and flag sign. Sir, edema. Edema, sir. Edema also in the kwashiorkor, sir. Hepatomegaly, sir. Hepatomegaly. Hepatomegaly in the kwashiorkor, sir. Sir, whenever we will see the skin of the child, you know, sir, protein is deficient. Means the health of the protein means health of the skin is also not good, and the skin is got dry, and skin is peeling out, sir. The skin is coming out easily, sir. So the peeling out of the skin, what we can call to that one? Can I say flaky paint dermatitis? Yes. So flaky paint dermatitis, where we will see, sir, again in the case of the kwashiorkor. Okay, again in the case of the kwashiorkor. These are the important point you have to keep regarding the kwashiorkor. Okay, chalo, very good. So next, let me come towards the marasmus. Sir, what is the main thing which is going to deficit in the marasmus, sir? Yes, main thing which is going to deficit in the marasmus is energy or the protein. Yes, so that is definitely, and the calorie or the energy deficiency is there. Calorie or the energy deficiency is there. So calorie deficiency, energy deficiency is there, right? Yes, sir. Which means carbohydrate we are not supplying. Means body need the energy. For that, what body will do? Body will break all the presenting protein and all the fat will get break. Body is going to break the protein and body is going to break the fat, and all the protein fat is going to loss from the body. So now consider this, whatever the protein we have on the cheek and here around the orbit, fat protein that is got vanish. Okay, muscle wasting is happening. So how the face will look like? This particular cheeks went inside and the eyes went inside like this. So like monkey like face, can we say? Monkey like face, right? Yes, the old man appearance or the monkey like face will be seen in a case of, yes, seen in a case of marasmus. Marasmus. Sir, here intercostal muscles all wasted, sir. All the muscles are got broken, sir. All the fat broken, sir. Protein broken, sir. Because of the less calorie, body utilized everything. Sir, easily this clavicle, chest ribs, and the everything which is getting easily visible. Are you able to see this child? See him, how thin he is. Okay, if you all together say, he will be going out of the screen. Okay, that much thin child will be there. Okay, chalo. So here you will be getting the and completely muzzle wasted child. So here muzzle wasting is there or not? Yes, here also muzzle wasting is there, but this is buried under the edema. Because of edema, you can't see the muzzle wasting here because here there is no edema. Here there is no edema, so there is and the easily visible muzzle wasting we can get. So this is about the and our marasmus. Okay, and this is about the our kwashiorkor. These are the 2 points you are going to keep in your mind, because from here questions have been multiple time asked. So quick revision. See here, in the kwashiorkor, what is going to deficit, sir? Severe protein deficiency is there. Okay. And in a marasmus, sir, severe energy deficiency is there. Sir, how the body is appearing, sir? Because of the protein deficiency, because of the less albumin, because of the less oncotic pressure, we have the edematous, moon shaped face, and a swollen belly we have because of the edema. Sir, here there is no protein deficiency, means no edema. Okay, no edema. Here the calorie deficiency, so body used all the protein fat for the energy. So completely wasted body, emaciated look we will be having here. Sir, edema is only present in the kwashiorkor. There is no edema in the marasmus. Sir, what about muscle wasting? Maximum severe muscle wasting will be in the marasmus. Here the muscle wasting is there, that is masked by the edema. Means that is hidden by the edema. Next we have is the hair change, sir. Hair change. The flag sign we will be getting in a kwashiorkor. And in the marasmus, the thin dry hair we will be having. There is no any discoloration in the hair. But here the discoloration of the hair we will be getting in the very important kwashiorkor. Next we have is the skin changes, sir. The flaky paint dermatosis means the skin will get dry and it will start to peel out. It will start to peel out. Okay. The next one is an appearance of the face. The moon face we will be see in a case of the kwashiorkor, and the old man face or the monkey like face we will be see in a case of the marasmus. Next we will be having, sir, hepatomegaly because of the compensation by the liver in the protein deficiency. In a case of kwashiorkor, the hepatomegaly is present, the fatty liver is present. In a case of, yes, yes, in a fatty liver you will be getting in a case of the kwashiorkor, and in the marasmus it is absent. And the appetite will be poor because here there is a no energy deficiency, here only protein deficiency, appetite will be poor. But here usually normal appetite we will get in the marasmus child. Okay. And the next will be the activity. Here the lethargic and irritable, and here the alert but weak activity will be there. So these are the important golden points. We can easily differentiate between the this particular table. Okay. After the class, do revision of one time. You will get more clear. Okay. Yes. Chalo. Any doubts? In a kwashiorkor, we will be getting the poor appetite, but in the marasmus, very good and usually very good appetite will be there. And in the marasmus, no, child will not be lethargic like this. In a marasmus, child will be very alert, but lack of energy, so weak child we have. But completely alert, mental status is completely alert. Here the child will be lethargic and irritable. Getting? So these are the point which you have to keep in our mind, right? Chalo. So next is this one, the management of the severe acute malnutrition. So I am going to make this one as in the 1000 star important again for your upcoming Norcet 11 exam. Okay, from here, what I highlighted and taught you in the last Norcet, also the question definitely which came in your exam. Again, the question may comes from here. Please do focus on the chart what I am explaining. See, whenever the severely acute malnutrition child will come, don't suddenly start all the refilling. If you are suddenly started to refill the nutrition, there is no the chance of the and refeeding syndrome and all going to happen. So what we are going to do, step by step, step by step, step by step, slowly, 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 we will replace all the electrolyte, lost glucose, everything step by step, step by step, step by step, we are going to provide here. Sir, what you mean by step by step? We have the 4 stages in the and very important management of the severe acute malnutrition. Okay, sir, what are the 4 stages, sir? First stage is the stabilization stage. And my question to all of you is, in the stabilization phase, can we give iron or no? Is my question. Yes, fatafat. If no, every one of you fatafat comment N. If yes, every one of you fatafat comment Y. Can we give iron in a stabilization phase or not? No? Yes. Sir, why? Why is my question? Because in the stabilization phase, body is very prone to get damaged easily because the child is in a very less immune function. So if in case we give the iron, iron is having the highest ability to produce the free radicals. That free radicals may directly damage the organs also. Okay, so which can directly damage the organs. So that is the reason we can't give the iron in a stage of the stabilization. Sir, in which stage we will give iron, sir? In the stage of the rehabilitation, we can give the iron. Okay, so in the stabilization phase, please to remember the golden word: no iron in the stabilization phase. Sir, where we have to start iron, sir? In the rehabilitation phase, we will start the iron. Iron supplementation starts here. Where, sir? In the rehabilitation phase. This is the important for your exam. This is important for your exam. Sir, what we have to do in the stabilization phase, sir? Just to stabilize the child. Sir, how to stabilize? This is going to go means continue for 1 to 2 days the stabilization phase, and here we are only preventing the hypoglycemia, only preventing the hypothermia and the dehydration, and if any infection, we will treat that one. And we will start with the F75 diet. This F75 diet is having the low protein, that is 0.9 gram. Sir, what is the meaning of the F75, sir? F means the formula which is having the 75 kilocalorie of energy for 100 ml. So for every 100 ml, it is having the 75 kilocalorie of the energy. So that is the F75. In this F75, we have the low protein, that is the 0.9 gram only. And in this stabilization phase, no iron we should not give. We should not give any iron. Okay? Yes. So next we have is this one. That is our transition phase. Means from the stabilization to the rehabilitation, slowly we are shifting. Okay, so that is we are going to shift from the F75 to F100. Sir, in the F100, what is the meaning of the F100, sir? In the F100, the formula which is having the 100 kilocalorie of the energy for every 100 ml of the fluid. Every 100 ml is having the 100 kilocalorie of the energy. So that is what we can call as the F100. So from the F75 to F100, in which phase we are going to shift in the management of the SAM? Fatapat do comment. In which phase we are going to shift from the F75 to F100 in the management of the severe acute malnutrition? Fatapat. Every one of you, fatapat. Do mention your answer. Very good, beta. So in a stage of the transition. In a stage of the transition. Very good. So next is this particular F100 having the protein. Sir, how much protein is present in the F100, sir? In a F100, we have the protein of the 2.9 gram. In a F75, only 0.9 gram was there. But in the F100, we have the 2.9 gram of the protein. While attending the test series regularly, after this class, you see the difference. If you are scoring the 55, 56, 60 marks, your marks will come near the 61, 62, 63. And if you are scoring 60 plus, you will cross the 65 plus. If you are scoring 70, you will cross the 70 plus. So this class will be most effective. Be till the end, because this is just a trailer what I shown till, and the picture abhi baki hai. Okay, chalo. So next is and the a very important a rehabilitation phase. In the rehabilitation phase, this is called as the ongoing phase. Here we have to give only F100 and the roughed feeding. The full form of the roughed is important for the exam. Sir, what is the roughed meaning, sir? That is the ready to use therapeutic food is the meaning of the roughed. Okay, ready to use therapeutic food is the meaning of the roughed. Sir, which phase we are going to use the roughed, sir? Erupt is going to use in the rehabilitation phase. So R to R, do remember. In the rehabilitation phase, we are going to use the rough. And sir, in which phase we can give the iron? So we can give the iron in the rehabilitation phase. The point which you have to keep in your mind, very important for the exam. Sir, when we have to discharge the child? So discharge and follow up we have to do. So that is after the recovery. Sir, when we can say the child is recovered, sir? Child is recovered when the child is meet the discharge criteria. Sir, what is the discharge criteria to discharge the child of the severe acute malnutrition? When his weight is increases and the weight for height is going to increase more than -2 standard deviation, more than -2 standard deviation, and sir, there is no edema in the last 2 weeks, and sir, child is completely active and child is eating well. So this is an very very important diagnostic criteria. Child should be eating well and the child should be not having any edema since from the last 2 weeks, and the weight for height is more than or equal to the most important -2 standard deviation. These are the important point, very important point. Please do keep in our mind. Okay, so I hope all the points on the severe acute malnutrition and its diagnostic criteria and its discharge criteria and its management, everything is clear to all of you, right? If it is clear to all of you, fatafat do thumbs up in the comment box, every one of you all together. Okay, if any doubts you have, mention in the comment box now, otherwise I am going to move for the next question. Sure. Clear? So here it comes to the next question. Next question. The question which is waiting for your brilliant answer. Which of the following is the most common cause of the fever on the post-operative day 1? Post-operative day 1. Most common cause of the fever in a post-operative day 1. What you will think? Yes? Very good. So everybody's answer is going towards the option C, and I am going to lock the option C here. So option C is the 100% is correct answer. So the most common cause of the post-operative day 1 fever is the pulmonary atelectasis. This is our Norcet previous year question. Please do remember the PYQ. Here you can see the quick revision table, post-operative days and most likely cause. Sir, day 0 to 1 atelectasis. If atelectasis is not there in the option, sir, which is the next best option, sir? Because of the inflammatory reaction of the surgical incision. Okay, inflammatory reaction to surgical incision. Okay, so just we have made the surgical incision and our body is showing some inflammatory reaction because some injuries happen to the tissue. So if atelectasis is there in the option, the single and first best answer. If this one is not mentioned in the answer, the second best answer goes to the, don't mention the infection. It's not an infection, it's a normal inflammatory reaction. You know, normally also here some injuries happen, here the inflammation will happen. Similarly, if you take the surgical incision, there also an inflammation will happen. Okay, so inflammatory reaction to the surgical incision. So that is the second best answer in the day 0 to 1. Okay, yes, sir. Sir, next is day 1 to 2, sir. That is pneumonia. Pneumonia is the day 1 to day 2. Right? Yes, sir. So next is, sir, day 3 to 5. Which one is best, sir? So that is the deep vein thrombosis or the surgical site infection. Other else, urinary tract infection. Okay, urinary tract infection. So now trending question and recently asked question in a INA-CET, so that you may get in your exam, is UTI. Okay, sir, is this applicable to all patient? No. So this is applicable to only those patient where in the post-operative period we have kept the Foley's catheter. If you have not kept the patient on the Foley's catheter, so answer will go to the deep vein thrombosis or the surgical site infection. Okay, if the patient is on the Foley's catheter, what is the most common cause of the and day 3 to 5 fever? So then your answer goes to the urinary tract infection. Okay, yes, clear to all of you? The next one is day 4 to day 6. We have the burst abdomen. Sir, what is the burst abdomen? Let me show the burst abdomen. This one. You can see all the content of the our GI which bursted out from the surgical site. So this is the burst abdomen. So this may be the one of the most common cause of the fever on the and day 4 to day 6 burst abdomen. Okay. And sir, day 7 to days 5 to 7, sir. So that is intra-abdominal abscess. Means inside the abdomen only abscess happened. So then how that will looks like, sir? You can see inside the abdomen abscess is happened means it will looks like this. Completely tight, tender abdomen. Okay. Yes, completely tight and tender abdomen it which will looks and which may going to cause the increased intra-abdominal pressure and which makes the surgical incision open. Surgical incision open. Okay. So this is on the case of the intra-abdominal abscess. You can see here the surgical site are open here. What you call to this one? What you call to this one? Yes, I will come to bag to bag surgery. Okay, tell me the answer. So here the surgical site is open, but not internal organ not protruded out. So that is called as the dehiscence. Okay, so please do remember. And my question is this a partial dehiscence or the complete dehiscence? That's a 10 question. How many of you remember? Very good, beta. So this is the case of the partial dehiscence. Partial dehiscence. From the here to till here, everything is open means so that is the complete dehiscence. And this is half only open. I will show one more image based question to you. So that may exactly means that may exactly takes you for the complete picture of the partial and complete dehiscence. Okay. So here we told on the day 4 to 6, the burst abdomen is going to happen. So what is the management of the burst abdomen, sir? This is the management of the burst abdomen. So what we are going to do, sir? We are going to do the bag to bag surgery. Your Norcet previous year question. Please do remember. Okay. So I think Norcet 8. Okay. So this is the bag to bag surgery. So what we are going to do in this one? We will take one sterile urinary bag, urinary bag which you use to collect the urine, so that is unused. Okay, don't take a used one. Unused sterile urinary bag we are going to take, and we are going to put back all the organ inside the abdominal cavity, and we have to suture the urinary bag here. Okay, so here suturing have to be done. So this is in order to protect the internal organs, in order to protect the internal organs. So this is called as the bag to bag surgery. This is the surgical management of the case of a burst abdomen. Okay, this is the surgical management of the case of the burst abdomen. Important for the exam, please do remember. Okay, and here it comes to the next image based question which is waiting for your brilliant answer. Do look at the image and try to identify the correct answer. Identify the condition shown in the image. Option A we have is the complete dehiscence. Option B we have is the evisceration. Option C we have is the partial wound dehiscence. Option D is the incisional hernia. Incisional hernia. Look at the image clearly. Let me zoom the image. Okay, let me zoom and show. Yes, complete means from here to here it will be open. See, only here is it opened and here is little bit open. And remaining area it is closed. Remaining area it is closed. So what you will think? Many people not read the all option, directly going for option A. Right? That we should not do better in the exam hall. You should read the all option. Even you know the question. Even you know the answer. Even you know the concept behind that. And if I ask you, you can explain the concept for the 5 minutes continuously to me. But still you make the mistakes because of the over excitement. You will feel, oh, Nagaraj sir taught me this one in the class. And I know this one. And I will put the correct answer directly without reading the option. This kind of the criminal mistake you should not do. I will not say this is a silly mistake. I will say criminal mistake. Okay? Clear to all of you? Do read the option completely till the end. And after reading all four options, decide your answer. Even you know, don't go for in the hurry burry because that is going to damage us. That is going to damage our rank. Right? Chalo. So here is the an option you can see option C is the complete wound. Option C, that is the partial wound dehiscence. Okay, you can see the image here. Partial wound. In the partial wound, what happens, sir? Only the part of the wound is open, not the entire wound. Only the part of the wound is open, right? And here we can see the next one, complete dehiscence. Are you able to see? Completely from here, it is opened. Okay, this is the complete dehiscence. You can see the entire wound is separate. Entire wound is separate. That is the complete dehiscence. Right? The next you can see the evisceration. Sir, what is the evisceration? From the an surgical site, from the surgical site, so the all the internal organ came out. From the surgical site, all the internal organ came out. So this is called as the an case of evisceration. Okay? Yes. So my next question to all of you is this question. The question which is waiting for your brilliant answer, and the question you will make repeatedly wrong thing in the test series also, and in the exam also you may get make wrong here. Okay, so I don't want any wrong option to choose you here. Do read the question carefully, completely till the end, and give your best possible answer. Yes. Who all are live to the session, every one of you, fatafat hit the like button also and give your answer also. So everybody's answer is going towards option C. Best. Best. See, there is on the post-operative patient suddenly develops the wound dehiscence with and the protrusion of the abdominal organ through the surgical incision. This case is on the wound evisceration case because wounds are separated, means wound edges are separated, that is the wound dehiscence, and the protrusion of the abdominal organ through the surgical incision. So this is on the evisceration case. As the nursing officer, what is the priority nursing intervention you are going to do here? And first priority answer is you are going to choose the and cover the exposed organ with a sterile saline soaked moist gauze. So now in the option you have informed to the physician and the cover the exposed organ with the and sterile saline moist gauze. Both are there in the option. So tell me now which is the correct answer. Tell me now. In the option you have informed to the surgeon and the cover the exposed organ with a sterile saline moist gauze. Which one you will choose? Inform to the physician or the cover? Yes. Which one you will choose? Inform? Yes, very good, beta. First thing is we have to cover. You think which one is going to prevent the infection? Covering or informing to the doctor? Which one is going to prevent the infection? Yes. Which one is going to protect the organ? Informing the doctor is going to protect the organ? No. First, you do cover the an internal organ which is exposed out, prevent the infection, prevent the damage to the exposed organ, then you can call. How much time it will take? Only hardly in 3 to 5 minutes. Okay. So first cover the exposed organ, then go for the and informing to the physician. And in this scenario, you must and should follow this particular priority only. See, you start from here and you have to end with here. Okay. So first cover the exposed viscera with sterile gauze dressing. So that should be moist. And sterile gauze dressing should not be dry. If it is dry, that is going to damage the our means that is going to damage our organs. Okay, it should be moist. It should be moist with a warm sterile saline soaked gauze. Sir, why not cold saline, sir? Why only warm saline? You know, if you are giving the warm saline, so if you are keeping the warm saline on this one, so that is going to keep the blood vessels dilated. You know, heat is going to dilate the blood vessel. Vasodilation will happen under the influence of the heat. And under the influence of the cold, the vasoconstriction is going to happen. So here, if you are keeping with a cold object, so the vasoconstriction will happen, and exposed blood means the exposed content may get the less blood supply. So that is going to cause the ischemia of the exposed part. So that is the reason we have to always go for the warm saline, and that is the moist. It should not be cold. It should not be dry. It should be warm. It should be moist. Okay, because in the option the examiner will confuse you. Here you can see apply the dry, like dry sterile. So dry should not be our option here. Even the same concept will comes in a most important condition where protrusion of the or the prolapse of the umbilical cord. In the prolapse of the umbilical cord also we have to go for the and most important covering the exposed part with a and warm and the moist saline only. Okay, it should be on the warm and the moist saline only. It should not be cold. It should not be cold. Okay, so this point you have to keep in your mind. Right, the next we will be having this is to prevent the drying and injury and infection of the particular content. After this, position the patient. Okay, so which content is protruded, sir? Mainly in all the situations, 90% cases we have seen that is the abdominal content only protruded out. So if you are giving the high Fowler's position to the patient, again the pressure will created on the abdomen, so abdominal content again may comes out. So first thing after covering the thing, what we have to do, we have to give the position. So which position? That is the low Fowler's or the supine position you can give with knee flexed. If the knee is flexed, the pressure on the abdomen is going to decrease. So that is going to reduce the tension on the an abdominal wound. So this is going to reduce on the tension on the abdominal wound. So which position we are going to give in case of the an abdominal content which is coming out? So abdominal organs are protruded out. In this condition, which position we will give? So the supine or the low Fowler's with a knee flexed. With a knee flexed, this is going to reduce the and pressure or the tension on the abdominal wound. Okay, next we have this one. Call for the immediate surgical assistant. Okay, so call for the immediate surgical assistant. This is the third priority, and do not push the organ back inside. Okay, don't try to push. Option A is telling push the protruded organ back into the abdominal cavity. No, we should not push. If you are trying to push on the organ, the pressure is created, means the obstructive shock is going to happen, right? Yes. So the next very important will be the keep the patient NPO. So why? Because we are expecting the emergency surgery. So immediately keep the patient and kneel per oral. So these are the points which you have to keep in your mind for your exam. Chalo. So next question, which is coming on this very important clinical practical question again. In the ECG, in the ECG, did the last concept is clear to all of you? What I explained in the last question, is that clear to all of you? If it is clear, fatafat do mention the thumbs up in the comment box, fatafat, so that I can proceed with the next question. Yes. Chalo. Okay. Yes, the answer has started to came here. The lead placed at the fifth intercostal space, anterior axillary line is, which lead is that one? V5. Can I log the V5 option B? Yes, sir. So V5 is the lead we are going to place at the fifth intercostal space in the anterior axillary line. You can see this image, which will give the complete clarity. See, we have the total 6 leads of the chest. V1, V2, V3, V4, V5, V6. Okay. Sir, where the V1 is placed, sir. So this is called as the right side of the sternum. So I call this is the right sternal border. And this is the left side of the sternum. I call this one as the left sternal border. Okay, yes, sir. And this is the first, second, third, fourth intercostal space. Yes, yes, sir. And this is the fifth intercostal space. Yes, sir. See, the V1 we have to place here in the fourth intercostal space, right sternal border. Only one lead where we are going to place at the right side is that is the V1. Sir, where that is, sir? That is in the right sternal border, fourth intercostal space. Important. And V2, sir, that is in the fourth intercostal space, same, but in the left sternal border. Sir, where we are going to place the V3, sir? V3 you can place anywhere between the V4 and V2. Anywhere you can place the V3, but it should be between the and V2 and V4. Between the V4 and V2, we have to place the V3 anywhere. And sir, where we have to place the V4, sir? V4 is placed in the mid clavicular line. This is our a beauty bone, that is the clavicle. Exactly from the middle of the clavicle, we will come down to the fifth intercostal space. In the fifth intercostal space, we are going to place the V5. And sir, where we are going to place the here we are going to place the V4. Okay, in the fifth intercostal space, mid clavicular line. And here is the axilla of the patient. This is the mid axillary line of the patient. And this is the anterior axillary line of the patient. In the same fifth intercostal space, in the anterior axillary line, we are going to place the V5, and in the mid axillary line in the fifth intercostal space, we are going to place the V6. Okay, so these are the very important points you are going to keep in your mind. You can see here, fourth, fifth. Only in the two intercostal space, all the leads are placed. So which are two intercostals, sir? One is the fourth intercostal, and all are the fifth intercostals. Okay, sir, fourth right side of the sternal border, sir, V1. Sir, fourth left side of the sternal border, sir, V2. V3 is anywhere between the V2 and V4. Okay, and sir, V4, sir, fifth intercostal space, left mid clavicular line, sir. Yes, sir. And the fifth intercostal space, that is the left anterior axillary line, sir. Fifth, sir, V5th. And the V6, sir, that is the fifth intercostal space, that is left side mid axillary line. So this question have been asked in your Norcet 3 times. Okay, total 3 times question have been came from the Norcet 2 to Norcet 10. So the lead placement in the ECG, the question 3 times asked in the exam, because this is practically important question. If you place the leads on the wrong thing, so the wrong ECG will come and unnecessary diagnosis will going to happen. Okay, unnecessary patient amount is going to waste, right? Yes. So please do keep in our mind, it is important for the exam. From here we can expect the question directly in the exam. Okay, chalo, next we have is this one. What is the normal duration of the PR interval? So question is about the PR interval, not about the PR segment. Guys, please do focus. The question is about the PR interval, not about the PR segment. Please focus on this one. In a healthy adult ECG, what is the normal duration of the, yes, in a healthy adult ECG, what is the normal duration of the an PR interval? Yes, from where to where the PR interval is going to start? Sir, this is, this is the P wave, Q, R, S, T. Okay, so this is the P wave. This is the beginning of the P wave. This is the end of the P wave, right? And this is the beginning of the QRS complex. Sir, this is the PR interval. From where to where, sir? That is from the end starting of the P wave to the end starting of the QRS complex. From here to here, we have the and very important PR interval. It is not in the segment, it is the interval. Sir, what is the PR interval? So that is from here to here we are going to measure from the starting of the P wave to the starting of the QRS complex. So this is our PR interval. Sir, from where we have means where we have the PR segment, sir, that is from the end of the P wave to the starting of the QRS complex. This is the our PR segment. Okay, so this is our PR segment. Sir, what is the duration of the PR segment, sir? What is the duration of the PR segment? You can see here, PR segment duration is 0.08 to 0.12 second. Okay, 12 second. Sir, then what is the and duration of the PR interval, sir? PR interval duration is, so that is an 0.122 to 0.20 second. So this is the point you have to keep in your mind. And the 90% of the student will not read whether this is the interval or the segment, and they will blindly go for the answer option B. That is actually the wrong answer. Okay, that is actually the wrong answer. Now it's clear to all of you. Yes, heart rate calculation also we will discuss. Now the concept what I explained, this is clear to all of you. Yes, 3 to 5 small boxes, that is going to make the and most important PR interval. Okay, so this you people will confuse in the exam as well. So PR interval is the big one and the segment is the small one. Remember, the segment is small. Small means again the very small time, that is the 0.08 to the and 0.12 second segment. The interval is that is increased means that is the big one. Okay, so that you have to remember with the 0.12 to 0.20 second. Okay, clear? Interval means that is little bit big and the and segment means small. Sir, you give mnemonic that so we can remember the 3 to 4 things collectively together, sir. So take a very important answer for this question. Option C. Who all are given the option C as a correct answer? Your answer is 100% correct. You can see an ECG component and its normal duration. Okay. So before going to this one, you do see this one. One small square of the ECG, that is the 1 mm in the length, is going to pass within an 0.04 second. If speed of the ECG is going 25 mm per second, so with this speed, if the ECG machine is running and to cross the one small box, how much time the ECG will take? That is going to take an 0.04 second. Sir, one small box in a 0.04 second means one large box it is going to take in a 0.20 second. Sir, why like this, sir? Because one large box which is made up of the 5 small box. 1, 2, 3, 4, 5. Okay. So one large box is made up of how many small box? One large box is going to, it is made up of the, and most important, five small box. Okay. Yes, sir. So here you have to remember, guys, for crossing this one very small box, it is going to take the 0.04 second. So you count 0.0 point, so 0.04, 0.04, 0.04, 0.04. So if you count this one five times, into 5 I make means this becomes the 0.20 second. Means one big box is going to cross in a 0.20 second, and one small box in a 0.04 second. This is the point you have to remember. Okay, sir. Sir, this particular P wave will be made of within how many boxes? This P wave will be made within a and 2 to 3 small box. Okay, two to three small box. So that two small box means, so two small bits, that is 0.08, because one means 0.04 and two means 0.08 and a three means that is a 0.12 second. You just multiply 0.04 into 3, that will be the 0.12. Okay, so the P wave and the QRS complex and the PR segment, these all will be made up of within 2 to 3 small boxes, and the time duration of this will be the 0.08 to the 0.12 second. Important for the exam. This is important for the exam. You see, only one timeline you remember, and you remember these three things. So that is the P wave, QRS complex, and the PR segment. Segment, complex, wave. One is the segment, another one is the complex, another one is the wave. Sir, which segment, sir? PR segment. Which complex, sir? That is the QRS complex. Which wave, sir? P wave. So these are all made up within how many box, sir? Within 2 to 3 small box. Okay. Sir, what is the time duration, sir? Time duration. So that is 0.08 to the 0.12 second. This is the time duration which you have to keep in the mind. Clear? Yes, sir. Next is PR interval. Sir, interval starting from here to here, sir. So that is, interval is starting from the, and most important, beginning to the beginning. Okay. So that is beginning of the P wave to the and beginning of the QRS complex. This one is called as the PR interval. So the time duration and the big boxes means boxes taken by this one will be the one big box, which means, and five small box. So five small box means one big box means 0.20 second, or in range you want to tell means 3 to 5 small box. Okay, that is 0.12 to the 0.20 second. So this is the and time taken for the from the PR interval. Next we have is the QT interval. So QT interval is the two big box it will take. So that is a 0.40 second. These are the points you are going to keep in the mind. Sir, which one will be asked in the exam, sir? The only thing which will be asked in the exam is, so that is our this box or the this one. In this one also, they will mistake, they will ask you this one only, because here only 90% of the students will do mistakes. So the which one is having the highest chance of mistake, that is the favorite for the examiner, and examiner will focus on that one only. So you do remember, interval, segment are the different, and segment is the small, interval is the infinity, or interval is the big. Clear? Clear to all of you? Yes, QT is two big boxes. That is, one big box is equal to 0.20 second means two big box is equal to and 0.40 second. Clear? Fatafat do thumbs up every one of you. If it is clear, fatafat do thumbs up every one of you. Fatafat. I want complete energy in the comment box, so that help me to boost myself to explain more thing to you all. I want response from all of you, all of you. Very good. So next is this question. Simple question, but important question, multiple time asked question in the exam. So different answers are coming. Option A, B, option A, B. Chalo B, B. Okay, so the answer for this question will be the, what is the most common position recommended for the patient immediately after the hip prosthesis, hip replacement surgery we have done. So what is the most common position you will recommend in this patient? So answer for this one will be the and supine position with pillow between the knees. Sir, why like this? Hip replacement we have done. After that, the main aim is, so we have the acetabulum cavity in the hip bone, and in this one, the head of the femur they have set. Okay, this is what they have done the hip prosthesis surgery. If you want to keep this head of the femur in the acetabular cavity, so you have to maintain the an abduction, which means the legs are apart like this. If the legs are coming together, this particular head of the femur will go out of the acetabular cavity. Okay, so if you are maintaining the abduction, so that is abduction pillow you are keeping, so it will keep the head of the femur in the acetabular cavity only. So that is going to, yes, that is going to helpful for the proper healing and the proper setting of the hip prosthesis. So that is the reason supine position with pillow under the knee is the endpoint we are going to give here. Okay, chalo. So next question will be here. What is the recommended position for the patient during the lumbar puncture for the spinal tap? For the spinal tap means you are taking the CSF for the any analysis of the CSF. So the question is asking about the recommended position of the patient during the lumbar puncture. During the lumbar puncture. So two questions will come. One is during the lumbar puncture, one is the after lumbar puncture. The small word, the during is going to change the answer. Okay, the small word during is going to change the answer. During the lumbar puncture, we are going to provide the left lateral decubitus position with the knee flexed and the hip is flexed, so that patient will be in a C-shape position like this. C-shape position, right? Yes, sir. So this is help for the and separation of the intervertebral disc so that we can easily perform the lumbar puncture. So this is the best position. But my next question is, so now we have done the lumbar puncture. After the lumbar puncture, which position you are going to provide is my question. Which position you will provide after the lumbar puncture? This was your Norcet 10 MCQ directly, which came from the and previous crash course what we discussed previous year, right? Very good, beta. So that is we are going to provide the flat position without pillow. Okay, we are going to provide the flat position. There is no head elevation. There should not be any foot elevation. No head elevation, no foot elevation. Sir, why this one, sir? Why? Because after the lumbar puncture, the cerebrospinal fluid may decrease and the CSF pressure may decrease. So that may going to cause the and very important is post lumbar puncture headache. Post lumbar puncture headache. So in order to reduce the post lumbar puncture headache, so we have to provide the flat position. Are you going to encourage the fluid in the patient with a lumbar puncture? Can we keep the NPO or we need to encourage the fluid? What do you will think? Yes, very good. So we need to encourage for the fluid in the patient, and if the patient is complaining any headache and all, we need to offer the coffee to the patient. Okay. So even after offering the coffee and the most importantly water intake, still the lumbar puncture is headache is coming means we have to assess the site for any leakage. If any leakage is there, so we have to keep the blood patch at the site of the lumbar puncture. Okay, we have to reinsert the needle and we have to leave a drop of the blood in the site of the lumbar puncture so that it can pack the, yes, which can pack the leaking area. So this is the point which we have to keep in our mind, right? Yes. So I hope it is clear. No NPO should not be keep NPO. Why will keep NPO? Already CSF is decreasing, fluid is less. If you keep the NPO, again the CSF is going to less. Okay, again the CSF is less means again the post lumbar puncture which is going to headache means that is going to worsen. So here you should not be keep NPO. Okay, we have to increase the fluid amount, encourage for the oral fluid. Okay, if required, give the IV fluid also. Along with that, offer the coffee to reduce the headache. And most importantly, if still the headache is not controlling after the lumbar puncture, we have to go for the blood patch. Reinsert the needle and leave a drop of the blood. So that is going to pack the leaking area and there should not be any leak again. Okay, clear to all of you? Clear? Chalo. So next concept we have is this one. Please do remember, focus the word. During the lumbar puncture, the C shape position is encouraged, or else after the lumbar puncture, the flat position is best. Okay, chalo. So next question will be this one. What is the recommended position for the patient during during the enema administration? Yes, during the enema administration. Which position you will recommend to the patient? Simple question, but important question. B option again. Every one of you are going towards the B option. Very good. Very good. So that is we are going to provide the lateral position. So that is the Sims lateral position with a an right knee bent. Sir, why we have to bend the right knee? So because if the patient is bending the right knees, the buttock is going to open so that easily we can insert the an lubricated end of the an enema administration tube. So that through that we can easily enter the tube, means we can easily enter the fluid inside the and rectum of the patient. Okay, so everybody's answer is very correct, and option B is the 100% is correct answer for the question. Next question is here. What is the recommended patient position during the percutaneous liver biopsy? Again, the question, very important. This is also asking during only. Do focus during the procedure or the after the procedure. If the during procedure, different answer, and the after the procedure, different answer will come. Okay? Yes. What is the recommended patient position we are going to provide during the percutaneous liver biopsy? Yes. See how mixed answer is coming. I am asking during. Option B is telling right lateral with pillow support. Right lateral with pillow support we are going to provide after the liver biopsy. This is after the liver biopsy. Sir, why the right lateral, sir? Why? Because the liver we have on the right side. If we place the pillow support and we turn the right side, what is going to happen? Pressure is going to create, so bleeding is going to reduce. So in order to reduce the bleeding, after the liver biopsy, we have to provide the right lateral with pillow support. So option B I eliminated. Right? So then, sir, option C, that is the left lateral position with and right arm extended. So little bit left side you turn, and this right arm should be behind the our head so that this particular area can expose, the liver area can expose, and the easily the needle can be inserted inside. Okay, so left lateral with a most important, sorry, option C also wrong, we can go. Okay, so left lateral is not recommended. No, no, not option C also wrong. This is also wrong. Better option we have, like better option than this one we have. You can see here. Supine with the right arm over the head. So this is the best. Option is the best than the option C. You can see here. Yes, we can go for the left if the patient is discomfort. But you can see here the supine with a right arm overhead. This is the best answer, better. Not option C also. See, I am going according to your answer. So the exact correct answer is option A. Okay. Yes. Option A is that this is the problem you see. If you are not reading the option from all, means the answer will going to go wrong. If you read the all option, the correct answer we are going to choose. Right? So the supine position with an arm should be go behind the head. So this is going to expose the particular um, area. Okay, so that is helpful for the insertion of the needle. Clear to all of you? The correct answer for this one will be the an option A. That is the supine with the right arm over the head. Okay, clear. Yes, your answer is A, means the correct answer is also A beta. Very clear. Okay, chalo. So remaining will be just under distractors. Okay. Next option is this one. Left lateral with the right arm behind. That is also we can go, but the best answer is what I said, option A beta. Okay. Yes. Here it comes to the next question, which is waiting for your brilliant answer. When a patient experiences an air embolism, what is the recommended position to help to manage the condition? What is the recommended position to help and to manage the condition? Patient is getting the air embolism. Fitafat. B. Trendelenburg. Option A is the left lateral position with a head down 15 degree. Right lateral decubitus with the head up. And option C, supine position with a head elevated 30 degree. Option D is the prone position with the head down. Very good, every one of you. So option A goes to the correct answer again here. So the left lateral position we have to go along with the and head of the bed 15 degree down, which means and Trendelenburg position we are going to provide. So that is the how much it should be down, sir. It is going to down 15 degree only, and the patient is turned to the left side. Okay. So the left lateral position with a head down, that is the 15 degrees, sir. Why this one only, sir? Why? Because this is going to trap the air in the right heart only. This will not allow the air to go into the pulmonary artery. Okay, priority position immediately after getting the and most important air embolism. So answer goes to the option A. Left lateral position with Trendelenburg position. Okay, so that is the and 15 degree head will be down. 15 degree head will be down. Okay, sir, why this one, sir? Why this one, sir? Because this is going to help the trap to air in the right atrium or else in the right ventricle, and it will not allow the air to go into the pulmonary artery. So that is the reason we are going to provide the and position left lateral with the and Trendelenburg position, that is the head of the bed is 15 degree down. So here it comes to the next question. Yes, but in the pulmonary embolism only we discussed. Yes, to trap the air in the right heart, and we our main aim is to air should not go into the pulmonary artery. If it is going to the pulmonary artery, pulmonary embolism will happen. Okay, that one only we want to prevent here. Okay. So which of the following pressure ulcer stages involves the full thickness skin loss with damage to the subcutaneous tissue, but no bone, tendon, muscle are exposed? 2 minutes break needed. So we will wind up the class at the 9 p.m. Don't worry. So 20 more minutes. Because now in the morning hours, I have taken the 3 hour continuous session to all my crash course students. So there also 3 hour I was keep on talking from the 11 to 3 continuously. Again, I have started at the 7. So my throat also needs a little bit rest. So at the 9 o'clock, we will wind up the session. Tomorrow, again, morning, we will start it out and we will complete the other session. Okay. Other remaining question we will complete. Don't worry. Alright, chalo. So, which of the following pressure ulcer stages involves the full thickness skin loss with damage to the subcutaneous tissue, but no bone, no tendon, no muscle exposed? The answer is going to be an option C, that is the stage 3. Stage 3. Okay, C. Important, very simple keywords you have to remember. If only an epidermis is involved and only discoloration of the skin, only epidermis is involved. Which one is this one, sir? Yes. Yes, but why? Because again, tomorrow also I can come live for you all. My throat should be okay, no? Then only I can come to the live, right? Yes. So only epidermis involved means stage 1. Okay, sir. Epidermis and the hypodermis also involved, sir. Epidermis and the hypodermis also involved, sir. What is your means? Still here the pressure also extended. What is your and very important answer? Yes, this is the stage 2. Sir, along with the epidermis and the hypodermis, sir, subcutaneous tissue also lost, sir. Subcutaneous tissue and the muscles also, sir. Sorry, subcutaneous tissue lost, sir. What is this? Hypodermis, dermis, and the subcutaneous tissue. Till here, the ulcer is extended. That is the and stage 3. Stage 3. And along with this one, sir, bone, muscle, tendons. Muscle, sir, bone, sir, and the tendons, sir, these all things exposed means, so that is the stage 4. Here in the question, no bone, no tendon, no muscle exposed. So till here only we have the and pressure ulcer. So this is the stage 3 pressure ulcer. Okay, this is the and stage 3 pressure ulcer. Very good. Every one of you have given the very correct answer. You can see the staging here easily. Only epidermis is involved, stage 1. Epidermis plus dermis is the stage 2. And the stage 3, that is the and subcutaneous tissue till the subcutaneous tissue. And the stage 4 till the muscle, bone, tendon. So that is the stage 4. Okay, that is the stage 4. And here it comes to the unstageable. Unstageable. Right? 5 we can say unstageable, sir. The pressure ulcer happened. Instead of that one, the scar formed, the hard cherry tissue formed. That is, we are unable to identify whether it is involved only epidermis or dermis or subcutaneous or muscle or bone or tendon or we are unable to differentiate. Because here the an ulcer is filled with the an scar tissue. Okay, that is called as the an unstageable. That is called as the unstageable. Okay, clear? Yes. Very good. So next we have this question. Which of the following is the most common site for the pressure ulcer to develop in a supine position? If you keep the patient in a supine position for very prolonged time, which of the following will be the and most important site of the pressure ulcer? Option A, elbow. Option B, option B is the sacrum. C is the heels. D is the occiput. Every one of you agree? Every one of you agree with the option B? Yes, B I am going to lock here. Very good answer. So B is the correct answer. Sacrum is the most common site of the and pressure ulcer in a supine position. You can see this is the supine position we given, and here the sacrum we have here. This is the bony prominence with a more pressure. Okay, bony prominence under more pressure. So this is the most common site of pressure ulcer in supine position. In supine position. Sir, which site is that one, sir? That site is called as the sacrum. That is the sacrum. So please do remember this one. From here we can expect the question in the exam. Okay. Chalo. So next we have is this question. Yes. Next we have is this question. On the Braden scale, the score is coming 12 or the lower than the 12. What it generally indicates? Sir, for what purpose we will assess the Braden scale? The Braden scale is to determine the risk of the this is to determine the risk of pressure ulcer. Okay, so here the score is coming 12. Okay, or the lower than the 12. So what is your interpretation? Yes. Option A, no risk of the pressure ulcer. B is coming moderate risk, sir. C is coming the severe or sorry high risk, sir. And D is no need for the repositioning. So D I eliminated. Yes. Netra, very good answer. And Karthik, very nice. Prince, Vishnu, very correct answer. C is the correct answer. So this is the high risk pressure ulcer. This is the high risk of the pressure ulcer. See, we have an very important 6 components in the Braden scale. So in these 6 components, we have the minimum score of the 6 and the maximum score of how much maximum score we have? 23. Minimum score of the and Braden scale is the 6. Minimum score. And the maximum score is an 23. Sir, how much the score will less? If the score is coming less, the risk will be more. Okay. So score will be less, the risk will be more. So this concept you have to keep in your mind. Right? Sir, how we are going to determine all 6 components, sir? The components of the Braden scale you have to remember with a and man with the SMS who is waiting for the girlfriend SMS. Okay. So man who is waiting for the and girlfriend SMS. So the man and SMS you have to remember. Okay, man is always going to wait for the girlfriend SMS, right? Right? Yes. So what is the man, sir, here? The M stands here is the and mobility of the patient. The mobility is less, means the patient is not moving, means the high risk of the pressure ulcer. Okay, sir? Yes. And sir, A stands what, sir, here? The A stands here is the activity. The patient is having the very less activity. High risk of the pressure ulcer. Yes or no? Yes, sir. And sir, what mean the N here, sir? N is the nutrition. Patient is having the low protein diet and the very less or the means the malnutrition condition going to increase the risk of the pressure ulcer. Okay. And what mean the yes, sir? Yes stands here as the sensory perception. Yes stands here as the sensory perception. And sir, what another M stands here, sir? The another M stands here as the moisture. If the patient is passing the urine, feces over the bed, fecal incontinence is there, urine incontinence is there. Because of that moisture, the skin will get emacerate. The skin will get emacerate means easily skin will get break, right? So the moisture is also keeps the patient with a high risk of the and most important bed sore or the pressure ulcer or the decubitus ulcer. Okay, sir. What about the another yes, sir? So that is the shear and the friction. So the patient is telling you to please do make me up in the bed, and you are pulling the patient. What you have to do? You have to slowly lift the patient slowly, and you have to place the patient up in the bed. And your shift is going to finish. The patient is calling you at the 1:55. Your shift is about to finish at the 2 o'clock. What you will do? Dara, dara, you will go and you will hold the patient and you will pull back on the bed. So that pulling is going to make the friction, and friction is going to break the skin. And the skin breaken, the high risk of the broadened skin. Guys, don't do like this. Even you can go to the home at the and 2 5 also. Okay, so 5 minutes less also you can go. Okay, give something for country, right? Give something for national service. The extra 5 minutes of the time will save the patient pain. Okay, pain is not going to happen to the patient. Okay, be responsible in the clinical setting because we are not dealing with a machine, we are dealing with a man, right? So the be kind and the be respectful and be responsible for your work. Okay, this is the point you have to I want to explain. Okay, chalo. Next is yes, I told the sensory perception. If the nerves are damaged, less sensation means pressure is created, but the not sensitizing because the nerve is damaged. So continuous pressure patient will not sensitize. Okay, so because of that one, what is going to happen? That is going to happen. The sensory perception is less means the risk of the broaden scale means the risk of the what we can say pressure ulcer is very high. Okay, yes. Chalo. The next one will be the this one interpretation of the Braden score. Right, the maximum score we have is the 23 and the minimum score we have is the 6. Minimum score we have is the 6. Okay, if the score is coming from the 19 to 23 means more than 19 no risk, more than 19 no risk of the ulcer development, and 15 to 18 mild risk is there, and 13 to 14 moderate risk, 10 to 12 is the high risk. And in the question which is mentioned how much, sir? In the question it is mentioned 12, which means high risk. Okay, yes. So if it is less than 10, that is 9 to 6, this is very high risk. Less than 9 is very high risk. Okay, more than 19 is, remember guys, 1 9, that is more than 19 is no risk, but 0 9, that is the less than 9 is high risk. Point to be keep in your mind. Okay, clear to all of you? Yes, 15 to 18 is the mild, and the 13 to 14 is the moderate. 1 9 and more is the no risk. 0 9 and less is the high risk. Sorry, not only high risk, very high risk. Okay, not only high risk, that is the very high risk. Very high risk. Okay, yes. The score is going to increase, the Braden score is going to decrease. Means the score is going to increase means the risk of the pressure is going to decrease. If the score is decreasing, the risk of the pressure will be high. So this is the point which you have to keep in your mind. Okay, lower the score indicates the higher the risk. Okay, the next is, and don't confuse, here we have the high risk and the very high risk category. This is also you may get confused. So you have to practice, and while practicing you do highlight high risk and very high risk. Okay, so this is, it will help you to easily focus during the revision time. Okay, chalo. So regular skin assessment we have to do, and all the six components, these six components we have to check regularly. Okay, so these are the points you have to keep in our mind. And the next question which is coming to here, and which is waiting for your brilliant answer. Ah, yes, Braden scale, Norton scale, the score is decreasing, risk will be increasing, right? Which of the following is the most important factor in the preventing the pressure ulcer in a hospitalized patient? Yes, frequent repositioning of the patient. How frequently? Every 1 hour, every 2 hour, every 3 hour. How frequently? Yes. How frequently will change the position of the patient? Yes, I agree with everybody's answer. Very good, beta. So that is, we need to change the patient position Q to H. That is every 2 hourly. Okay. So every 2 hourly we need to change the and position of the patient in order to prevent the pressure ulcer. And we have to make sure that very frequent skin assessment to be done. Okay. If the bedridden patient, frequently we have to do the skin assessment, especially in the bony prominence areas. And we have to frequently check the bowel and bladder need of the patient. If the patient is the incontinence, we have to put the folies and all. Otherwise, wet bed is increases the risk of the pressure ulcer. And if there is wrinkles on the blood, means the a bed sheet is folded, wrinkle. So that is going to create the pressure at the bony prominence. Again, the risk of the peptic ulcer, risk of the pressure ulcer will be high. So that is the thing. To keep the bed sheet dry, keep the bed sheet clean and the neat. Okay, so this is the very important point to be keep in our mind. The next question is here, which is waiting for your brilliant answer. And this is your assignment question. This is your assignment question. Wrinkle free bed sheet, and there should not be any what we can say, moist, and should not pull the patient, don't make the friction and all. Okay, chalo. So I will give the clue in this question. Every one of you do comment the answer for this question. See, the male is brought to the emergency department after the motorcycle accident. Patient is pale, diaphoric, heavy sweating, confused. His BP is less, hypotension. Okay, BP is less, hypotension, and heart rate is more, tachycardia. History of the motorcycle accident, and the respiratory rate is normal, 26. Abdominal distension means inside the abdominal cavity bleeding is happening. So that is internal bleeding. Internal bleeding. Hypotension, tachycardia, internal bleeding. So these are the three key words you have. Okay. Yes. What is your answer now? What is your answer now? Very good. Everybody's answer going towards the correct answer. So same answer you do keep in the comment box, and how the session was went. So do write two very important line, or the at least one important line regarding the a class as a feedback in the comment box at the end of the session. And if you really like the session, do share the class in your WhatsApp status, and do recommend to your juniors how the classes are going, and how helpful it was, how exam oriented it was, how focused it was. So that is going to help them also in order to get the in the right direction. Okay, chalo. If you want to take the crash course better, on the screen you will be getting the our helpline number. Do contact to that helpline number, they will help you out. Okay, chalo. Fantastic. Okay, so on the screen you will be getting the helpline number. Do contact to that one, and the notes of the this particular class you will be getting in the and most important master nursing classes official app. The link of the app I am going to provide you in the comment box. Okay, so from there you can download the app and you can access the notes also. Okay, chalo. So thank you so much. We will meet in the tomorrow morning session, and the remaining question I will cover in the tomorrow morning. And don't forget to join the tomorrow morning session also. Every day we will make it engaging, every day we will make it learning, and every day we will try to improve. Okay, so thank you so much for the brilliant response in the session. Okay, chalo. So we'll meet tomorrow morning. I will update the timing in the our very important official WhatsApp channel. So channel link, app link, everything I will give. Do download and be updated. Okay. Chalo. Bye bye. Take care. Thank you so much. Jai Hind. Jai Bharat. Jai India. Jai Karnataka. Jai India. Bye bye guys. Bye bye. Take care all of you. Tomorrow morning class time I will update in the WhatsApp channel. So do join there and you will be getting the time in advance. Okay. Okay guys. Bye bye. Yes, Jai Tamil Nadu, Jai Kerala, Jai Andhra Pradesh, Jai Telangana, Jai India. Yes, Jai Rajasthan also. Jai India means all. Jai Karnataka, everything. Okay, chalo. Bye bye.